Welcome to week 9 of the course. We are going to be continuing our discussions on the important topics related to healthcare and older adults. This lecture is about ethical decision making, which I feel needs a bit more coverage than what was given in the textbook. NIU offers an entire semester course on this topic, so this is going to be a quick overview. But it is content that I would like for you to understand and be able to respond to on the final exam. An ethical decision-making process helps us to ensure that the patient remains at the center of healthcare decision-making. I'm sure you are aware that oftentimes older adults can get lost in the wishes, the desires, the demands of family members, even physicians, and other healthcare professionals. And oftentimes that's because there is a perception that the patient is not cognitively able to participate in decision making or even physically not able to participate. It also stems from our societal beliefs about aging, death, and dying. And we have to take caution and care to ensure that decisions that are being made in the best interest of the patient and not being driven by other factors that could potentially do harm to the patient or that are against the wishes of the patient. In my 31 years working with older adults, I've often seen this phenomenon happen, and I've seen decisions that have been made that circle around the wishes and desires of the family members, physicians, and even the staff, with little regard to the impact on the elderly patient's quality of life. There are 11 moral principles that can be utilized to guide ethical decision-making discussions. They are autonomy, non-maleficence, beneficence, utility, justice, truthfulness, disclosure, confidentiality, universalizability, fidelity, and informed consent. I'm going to run through each one of these for you. Let's start with autonomy. And I'm guessing that this is a word and a term that you are probably very familiar with. Autonomy is the recognition and respect of a person's right to make their own decisions. This is also referred to as self-determination. It gives an individual a level of power, capacity, authority, and prerogative, and the opportunity to exercise choice and live with the results of those decisions. We all want autonomy. We want to exercise as much decision-making and control over the direction of our lives. This is a moral principle that must be at the top of the decision-making discussions. What is or would be the person's wishes in a particular situation? The second principle is non-maleficence, which is based in the Hippocratic Oath to do no harm. It is the decision that's being made harmful to the person? And harm can be thought about in different ways: physical, psychological, emotional, and even in the spiritual sense. On the flip side, beneficence is about acting in such a way as to produce the greater amount of good over harm. It focuses us on the consequences of actions and asks the question, does this decision produce more good than harm? The next principle is utility, which focuses attention on the sum of the benefits for an individual minus the costs or disbenefits to the patient. Here is an example. This was several years ago in my experience. We were dealing with a 99-year-old patient whose cardiac surgeon wanted to perform a mitral valve replacement for a 99-year-old lady. The family considered the position of the physician. The physician, in my opinion, didn't have the best interests of the patient at heart. What the physician's interest was his own, and being able to tout the success of conducting a mitral valve replacement on a 99-year-old woman. The family elected to move ahead with the surgery, and unfortunately, the patient did not do well, ended up having a stroke on the table, and remained in a vegetative state for months until she passed away. I think many of us would evaluate that situation looking at different moral principles. The last one I mentioned, which was utility. Was there more benefit to the patient than harm? More bad than good? The question of autonomy. Is this what the patient would have decided for herself? How about non-maleficence? Do no harm. I think in this particular situation, there were many ethical principles that were violated here that were not in the best interest of the patient. The next moral principle is that of justice. A topic we think of related to our legal system, but we don't necessarily think about it related to our healthcare system. And it's really the same concept. It relates to the equality of opportunity, fairness, and the equal distribution of benefits over harm. Truthfulness is the next ethical principle, and it's fairly straightforward. It directs us to ask whether honesty and clear presentation of facts has been communicated to the patient. Again, the example that I mentioned to you. I don't believe that the cardiac surgeon was being truthful with the family or with the patient in terms of discussing the benefits and risks of such a procedure. The next moral principle is disclosure, which is similar to truthfulness, but it takes things a step further. Have we disclosed all of the facts that is material to a person's reasonable ability to make a decision? Are we withholding information that could potentially sway a patient from making a decision in a direction that we want them to go? You are probably familiar with confidentiality. If you have been in a physician's office lately, you will sign a HIPAA disclosure statement that discloses the office's policies around confidentiality of your patient information and protection of your privacy. There needs to be a focus on what the patient considers to be private. Universalizability is related to do unto others as you would have them do unto you. Or, if it were me, what would I want? The next moral principle is called fidelity. It is about the right of a person to continue services that are aimed towards one's own interests and the rejection of possible conflicting interests. It's about keeping a promise on behalf of another person. And the final principle is informed consent. It refers to exercising the right to authorize a healthcare professional to provide care, absent control of others, and with substantial understanding of the risks and benefits of such procedure. There are complicated ethical issues that arise in the care of older adults, and there is often a genesis of the conflict, which rests in competing ethical principles. Some examples are conformity and efficiency versus autonomy. So, in other words, what that means is, well, we're just going to do what everybody thinks we should do, even though it could violate a patient's autonomy. Personhood versus universalizability. Personhood is respecting who people are as individuals, their history, their needs, desires, their values. All of those things comprise who we are as people. But then universalizability moral principle is, if it were me, what would I want? So oftentimes, when family members are making decisions based on what they think they would want, it's not necessarily in conformance with what the patient would want or what we know about the patient's history and values and who they are as a person. How about non-maleficence versus disclosure? We don't want to do harm to people, but we also have to tell the truth and be fully upfront about decisions related to healthcare and about understanding what's going on. And how about need to know versus confidentiality? We have run into this issue with a patient who has multiple family members, multiple children, and the resident has designated one of the children to be their power of attorney for healthcare, which means that the facility is really only supposed to be communicating with the power of attorney for healthcare as it relates to the care of the patient. But oftentimes, facility staff are confronted by the other family members who are demanding to know information. So is it in the best interest of the facility to fill the other family members in on what's going on, or do we respect the confidentiality of the patient? So there are ethical principles that are often at war with each other that can create conflict. So the key concept to understand about the ethical decision-making process is that discussing and evaluating these concepts does not lead to one and only one right decision. These principles can be used to guide discussions. And it is through the discussions that decisions can then be made. A well-accepted model for ethical decision-making is called balancing. And it begins with, first, viewing that all of the moral principles are equal. One is no more valuable or important than the other. The second step is to define the issue or the question. The third is to identify the choices. The fourth is identify the conflicting principles. The fifth, weigh the choices. And the sixth is to make a decision. So let me walk you through a quick case study. And you will find let me walk you through a case study. And you are also going to find two other case studies in this week's folder, which I'll talk more about in just a moment. So this is a real-life ethical decision and dilemma that we faced in my facility a while back. And the issue in question is if the nursing home should restrict a son from visiting the patient because the son has been consistently interfering with the care of the resident. And examples of the interference include walking into the shower room during the process of care to supervise what the nursing assistant was doing with his father, canceling physical therapy appointments and sessions for his father, yelling and confronting the staff on a consistent basis. The issue was that the staff felt that the son's behavior was affecting and impacting the quality of life for the resident, and his behavior was impacting the patient's ability to make progress. So the facility perceived that the resident was being harmed. So the question was, what do we do about it? Should we continue to allow the son to visit the resident? The conflicting principles at hand, not mentioning all of them, but just a couple key ones, are autonomy. The resident told us that he wants his son to visit. Non-maleficence is doing no harm to the patient. So by us continuing to allow the resident to visit the son, were we, by default, actually causing harm to the resident? So an interdisciplinary team formed to weigh all of the issues. This resident was not really able to participate in the conversations or follow along due to his cognitive limitations. We acknowledged the right of the resident to have his son visit, and we knew that that was equally as important as the harm that the staff perceived was being perpetrated on the resident. Another significant factor at play was that the son was not just impacting the well-being of his own father, but of other residents and family members due to his behavior. Therefore, the team concluded that the restriction should be placed around the son's visiting. So we determined that a code of conduct document needed to be created, and a meeting was held between the administrator and the son. The ethical dilemmas were explained to the son and the conflict that the staff were experiencing. And it was explained that we respected the right and wanted to uphold the right of his father to have visitors and to have him visit, unrestricted with his father. The son, had the son not signed the code of conduct, visits would have been restricted, and the nursing home ombudsman would need to be contacted to assist in continuing to attempt to reach resolution. Fortunately, we didn't have to do that. The process of discussing the ethical decisions at play helped us form a path of resolution with the son. And discussing the ethical principles helped the team to avoid personalizing the situation and making decisions based on what they felt about the son. He was not a nice person, but that's not a reason to ban him from visiting his father. Approaching decision-making from this perspective helped the son to see the issues more clearly, versus sending a message like, "You are being rude and disrespectful to everyone, so you have to sign a document before you can come back and visit your father." Discussing this from the basis of the ethical principles changed the tone of the conversation from being defensive and difficult to being productive and reaching resolution. There's a book by Rosalie Kane that focuses this topic of ethics on everyday life in the nursing home and how unintentionally the policies and procedures and beliefs, like old people don't need to be purposefully engaged, violates basic ethical principles and negatively affects the quality of life for residents in nursing homes. The topic of ethical decision-making is not just limited to people who live in nursing homes. It relates to people in hospitals, people in assisted living, people who are receiving outpatient therapy treatments, home health care services, and the like. It really provides a neutral base in which to have productive discussions that will hopefully lead to a positive resolution with the patient's best interest always being at the center of the conversation. And most of you probably are aware that, especially in the nursing home and in the hospital, there are a lot of emotions flying back and forth. And oftentimes decisions are made during emotional moments. As healthcare professionals, we have to try to guide the conversations away from the emotion and toward the patient and what the patient's best interest is. In this week's folder, you will find 2 case studies. I would like for you to pick one and provide some analysis about the ethical principles at work and how, if you were a team member in the situation, would you go about attempting to resolve the issue and find resolution. Also in this week's folder, you will find a written description of all of the ethical principles that I've just discussed in this video. I hope you have a good week, and if you have any questions or concerns, don't hesitate to reach out. Thank you.